So what brings you in here today, Katharina?
I'm just here for an old school medical exam. I just want to get everything checked out to make sure that everything looks normal, you know?
Excellent. It's very good to be on top of your health, so I'm happy that you came to see me today. I'll do a very thorough examination starting with your head, moving down your body, all the way down to your toes. Do you have any tingling sensation in your arms, your legs?
No.
Okay, very good. Any tender areas that may begin to hurt when I palpate them?
No.
I'm going to start off by taking your vital signs. I'll listen to your heart first, your lungs, and we'll take it from there. Let me just warm this up. Just relax and breathe normally for me. So I'm looking for any murmurs, any swooshing sounds that not belong to your heart. Not noting anything abnormal. I'm able to hear S1 and S2, not hearing S3 and S4, which indicates no heart failure, and I'm hearing a good steady rhythm. Okay, I'm going to listen to your lungs. Take a deep breath in for me and out. In and out. In and out. In and out. I'm not hearing any crackling, no signs of pneumonia or infiltrates. I'm hearing clear and clean sounds coming from your lungs. Most wonderful. If you can please place this arm across your body. I want to listen to the base of your lungs right here. Deep breath in and out. In and out. In and out. Wonderful. So the base of your lungs is also clean. Okay, I'd like to take your pulse next. May I please have this hand and this one, and I will compare the two, make sure that they're synchronized. Well done. I'm also going to take the pulse over your brachial artery, feeling a normal pulse character, about 75 beats per minute, which is normal. And I'm going to feel the pulse on your neck as well. Look that way for me. And just breathe normally. Normal pulse. Excellent. Next up, I'm going to take the temperature over your forehead and behind your ear. (98.5). You don't have a fever, which is very good. Have you been sick in the last couple of weeks at all?
No, not at all.
Okay, very good. And finally, I'd like to take your levels of oxygenation. May I please have your index finger? And this will only be a second. 9, 8, 7, 6, 5, 4, 3, 2, 1. 99% oxygenation, very good. 70 beats per minute. So you're very relaxed and oxygen is flowing through your body and through your blood at a normal rate, which is very good. Let's also take your blood pressure. Do you have an arm preference?
This one would be good.
Okay, let's do this one, since it's closest to me. Right there. Going to place this one right here. Close this up. And just relax for me. Let your arm loose. (125/70). That's a very normal blood pressure. Okay, I'm going to go ahead and mark those vital signs down to make sure we have a good reference here for the future. So normal temperature 98.5, 120/75, blood pressure, good levels of oxygenation, normal pulse, and heart rate. Wonderful. Okay, next up, I'm going to palpate your head and I'll be feeling for any lumps or bumps, anything out of the ordinary. Is it okay if I come close and touch your head? Okay, just relax for me. Any tenderness when I'm touching you like this?
No, it's the opposite. It's very comfortable.
Okay, wonderful. I'm going to feel your head from the back as well. Make sure I compare the two lobes of your head. So no pain or tenderness is noted when I press down. Not feeling any lumps or bumps. You have a very symmetric head.
Thank you.
Any pain right here?
No.
I'm going to feel your lymph nodes. Touching right above your clavicles. No lymph node enlargement is noted. I'm going to check your thyroid gland. If you can please look up for me. Thyroid gland is barely palpable, which is very good. I'm not feeling any lumps or nodules. Can you please swallow for me? It moves up and down as expected. Okay, so I'd like to take a look at your head next. Your hair, your scalp, just do a very good quick inspection with my light. You can please look that way for me, over to your left. So your scalp looks very clean, well hydrated, no signs of dandruff. No signs of psoriasis, ringworm, or any other abnormalities of the scalp. Okay, I'm going to quickly check for parasites with my device here. Continue looking to the left. Over at the base of the head, behind the ear, and around your temples. Wonderful. No signs of any infestation is noted over on the right side. I'm going to look on the left as well. Can you please look this way for me? Okay, let's go ahead and move on the other side. Can you please look that way from me, over to your right. Again, no signs of any abnormalities on this side of your scalp either. Good, healthy pinkish color. The color of your scalp blends well with the color on your face and your neck. I'm going to check for any potential infestation on this side as well. Oh, good, wonderful. Okay, so I was not able to find anything abnormal with your hair, your scalp. I'm going to go ahead and inspect your face next. So just by looking at you in normal light condition, I see that your pupils are round and reactive. I'm not noting any lesions on your face, no scars, abnormal moles. Let me just quickly inspect with my light as well. Just checking for any inflammation, how your skin reacts to my touch. Just a light palpation. Let me know if you feel any pain. Do you feel any pain when I touch you here? So no pain noted. How about over your sinuses?
A little tiny bit.
Okay. Right there.
Pollen season.
Okay, so your sinuses could be a little bit inflamed. Probably due to the allergies that are going around in the month of April. Any pain right here?
Mm-mm.
Can you clench your jaw for me? Unclench. Gonna try to move your head side to side. Resist that. Very good. Can you puff your cheeks out for me? I'm going to attempt to press onto them. Resist that. Excellent. Can you give me a big wide smile? And a frown. Excellent. All right. Let me make a couple of notes. So good hair, no signs of infestation, no abnormalities of the scalp noted, a little bit of tenderness over your sinuses. Other than that, good healthy skin, very well perfused. Most excellent. Okay, next up I'm going to perform a skin sensitivity test on your face. So I'm going to test your facial sensations. Can you please close your eyes and tell me if you feel this equally on both sides of your forehead?
Yes.
V1 is clear, equally on both sides of your cheeks.
Yes.
V2 is clear, equally on both sides of your jawline.
Yes.
Excellent. Okay, continue keeping your eyes closed. Can you tell me where I'm touching you on the face?
Forehead. Right cheek. Chin. Nose. Left cheek. Neck.
Excellent. Next up, I'll touch you with two different textures. One of them is sharp and pointy, the other one is fluffy or dull. Tell me which one I'm touching you with.
Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp.
Excellent. Okay, next up I'm going to swipe my fluffy wand over your face. Can you please tell me if I'm going clockwise or counterclockwise from your point of view?
Clockwise.
Excellent. How about now?
Counter.
Excellent. So no loss of facial sensitivities noted. Next up, I'd like to check your eyes. So you mentioned a bit of blurred vision about 2 months ago. Since then, has that returned at all?
No.
No. Okay. So if you could please look towards me and now up. I'm going to press down gently on your eyes and inspect the base of your eyes. Okay, that all looks normal. This one as well. Look up. Normal. No signs of jaundice or iron deficiency or anything abnormal. Can you please look at the tip of my nose? Alright. And from above and below. Excellent. So pupils are responsive to my light, dilate and contract in the normal amount. No signs of concern. Next up, I'm going to inspect your optic nerve a little bit closer. Can you please look in the distance for me? And I'm going to shine a light and take a look at your optic disc and assess its consistency. Alright, I'm able to visualize the optic nerve, which is intact. I'm not seeing any cornea detachment or scratches. That looks normal. Most excellent. I'm going to inspect the other eye as well. I'm going to just press lightly down and shine my light. And optic disc is intact. I'm seeing a normal amount of veins, red, pink, normal color. Excellent, looks very good. Alright, next up I'm going to check for red color desaturation. Can you please tell me if this red is just as bright as this red? Excellent. And as the ball moves towards you and away from you, does it maintain the level of redness or does it become more pale?
It stays red.
Stays the same, right? Okay. Excellent. I'm going to test your vision. Can you please cover one eye? And tell me what letter this is.
E.
This one.
T. F. P. H.
Can you please read this bottom row for me?
L. T. F. P. H.
Okay, what color is this?
Red.
How about this one?
Green.
What number is this?
9.
How about this one? What is this letter?
O.
Excellent. Can you please cover the other eye? And read the second row.
L. T.
And what letter is this?
E.
How about this color? What color is this?
Red.
And this one?
Green.
Can you please read this row for me?
D. H. J. B. S.
Excellent. 20/20 vision.
Thank you.
Now I'm going to test you for potential color deficiency. I have here Ishihara's tests. Going to flip through them, and I want you to tell me what number you see and trace it with your finger. First tell me what number you see and then trace it.
8.
Excellent.
6. 29. 57. 5. 3. 15. 74.
Very well. How about these ones here? Brown and green.
2. 6.
Excellent. They're going to get a bit harder as we progress through the booklet.
87. 45.
Very well. And the final one.
5. 7.
Green on red. Excellent. So no color deficiency noted. Here I have here a series of cards of different colors. Can you just tell me what color this is?
Orange.
I have this one.
Yellow.
And this one.
Pink.
This one.
Purple.
And finally this green. Very good. No loss of color noted. Okay, next up I'm going to go ahead and focus on your ears, your nose, and your mouth. So far I was not able to find anything abnormal. Have you ever had any problems hearing, any ringing in your ears, tinnitus?
I've definitely had really bad tinnitus in the past, and I do still have tinnitus, but it's not as bad as it used to be.
Okay, well, let's go ahead and take a look at your ears. Can you please look that way for me? I'm going to just do a visual inspection first of the auricle of the ear, so I'm not noting anything abnormal. Do you feel this? Does it hurt? How about this? Does this hurt?
No.
Okay, so no moles, no discharge, healthy pinkish color. That is all quite normal. I'm going to go ahead and look inside your ear with my otoscope. Just relax, and it's only going to last for a second. So I'm able to visualize your tympanic membrane, pearly gray. No discharge, no inflammation, no wax buildup, and not able to note anything abnormal. Excellent. Let me take a look at the other ear as well. And relax. I'm going to inspect the outside of your ear. Looking at your ear auricle, Looks quite normal, no external discharge, no redness or swelling. Do you feel this?
Yes.
Okay, does this hurt?
No.
How about this?
No.
How about when I pull down?
No.
Okay, no nodules. Skin looks reactive to my touch. Let me take a look inside the ear canal as well, at your eardrum. Just relax with me. Pearly gray tympanic membrane. Eardrum is not perforated. No discharge. No signs of a ear infection. And all looking quite normal. Right, next up I'm going to go ahead and test your hearing. Can you please close your eyes? I'm going to make a sound in each one of your ears that makes a clicking sound. Can you please count how many clicks you're hearing?
2, 3, 1, 3, 2, 3.
Excellent. Next up, I'm going to use my tuning fork to strike it and cause a vibration, and I'll place it on 2 different positions. Position number 1 and position number 2. I want you to first tell me if you hear the vibration and then when it stops.
I hear it.
Position 2. And which one is louder, 1 or 2?
1.
Okay, and then one more time, tell me when it stops.
It stopped.
Excellent. I'm gonna go ahead and do the same on the other ear. Position 1 and position 2. Which one is louder?
1.
Excellent.
Now.
It stopped. Very good.
Sorry.
Alright, next up I'm going to ask you to continue keeping your eyes closed. I'm going to make a sound around you. Tell me when it stops.
Now. Now.
Excellent. So I'm not able to note anything wrong with your ears. Healthy ears on the outside and the inside, and good hearing. What I'm going to do next is check your nose. I'm going to start by doing a light palpation, feel for any lumps and bumps. You can stop me at any moment if it feels uncomfortable. The bridge of the nose is straight. Can you take a deep breath in? Okay, deep breath in and out. Excellent, so both nares are patent. I'm not feeling any lumps or bumps. Let's go ahead and take a look inside your nose as well. Can you please look up for me? And I'm just going to visualize the inside of your nose. Seeing pink and moist nasal cavity, no signs of a deviated septum, no redness or swelling. Okay, let me take a look at the other one as well. If you can look towards me and just relax. Pink and moist nasal cavity, no signs of an inflammation, little bit of mucus, normal color in the normal amount. No signs of a deviated septum. So your nose is very healthy.
Awesome, good to know.
Next up, I'd like to test your sense of smell. I'm going to spray a mist in the air. Can you please tell me what it smells like?
Coconut.
Coconut, excellent. And can you please identify this smell for me? Going to obstruct one there.
Smells like chocolate.
Chocolate, very good. And I'm going to obstruct the other nair.
Coffee.
Coffee, very good. Right, so next up I'm going to focus on your mouth. Can you please stick out your tongue for me and say ah? Okay, no signs of any inflammation, teeth are intact, no signs of any cankers or sores. That's very good. Next up, I'm going to do a dentist check, and I'm going to check for any cavities, any sensitivity on your teeth. I'm going to tap on each one of them. Let me know if you feel any discomfort whatsoever.
Okay.
Okay, so I sanitize my tools. Look up for me. I'm going to tap on the bottom teeth first. Excellent. So bottom teeth are intact, no sensitivity noted. So your gums are not bleeding. Patient is not noting any pain. Not noting any cavities. Okay, patient not noting any pain still. Most excellent. So the inside of your mouth looks very healthy. I was not able to see any cavities or brown spots, which is very reassuring.
Thank you.
Okay, what I'm going to do next is test your sense of taste. I have here a couple of vials with different essences inside them. I'm going to spray them on these 3 cotton swabs and place them on the tip of your tongue. Tell me, what is it that you're tasting?
Okay.
So this is one essence.
Strawberry?
Strawberry, very good. And another essence. Let's see what this taste is.
Pineapple?
Pineapple, very good. And finally, the last essence.
Watermelon?
Watermelon, very good. That was a bit tough, so you did great.
Thank you.
What I'm going to do next is focus on your upper limbs. May I please have this arm? I'm going to inspect it first. I'm going to do a light palpation. Do you feel any tenderness when I press on it?
No.
No signs of edema. Noted. I'm going to inspect your nails. And can you please place your palm up for me? Alright, no sign of any nail clubbing or koilonychia. Palmar creases are not pale, no signs of palmar erythema. Does it hurt when I press down on your joint?
No.
Capillary refills within 2 seconds, which is quite normal. Your fingers are not swollen. Okay, let's test your sensations. Can you please close your eyes? And you should feel a very light scraping. Tell me if you feel any sharp shooting pain or any weird sensation.
No, it's very comfortable.
Alright, palms up for me. We're going to do the same test. Any sharp shooting pain?
No.
Wonderful. Alright, let me inspect this arm as well. Just a quick palpation. Your skin is very well perfused, no redness, no scars or moles that are abnormal. Going to inspect your nails. No signs of nail clubbing or splitting, which is a very good sign. Palms up. Palmar creases are not pale. No signs of red palms or palmar erythema. Capillary refills within 2 seconds, normal. Can you please do this, mirror me, and press down on your joints? Does that hurt?
No.
Okay, how about this? Okay.
No.
Very good. Can you squeeze my palms? Tight, 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 tight. Good squeeze. Excellent. Can you do the okay sign for me? Excellent. Don't let me pull through. Very good. Spread your fingers wide apart as they go. I'm going to attempt to press them together, bring them together, so don't let me do that. Very good. Very good. Don't let me bring them together. Now don't let me spread them apart. Excellent. Very good. Strong fingers. Don't let me spread them. Very good. Give me your palm. I'm going to draw a letter. Close your eyes and tell me what I'm drawing.
O. T.
Very good. Right, I'm going to focus on your abdomen next. I'm going to have you lie down for this part of the examination.
Okay, thank you.
Okay, next up I'm going to palpate your abdomen and feel your internal organs. Is it okay if I lift your t-shirt up slightly?
Mm-hmm.
Okay, I'm going to begin by doing a light palpation. And check for any organ enlargement or any lumps, bumps, anything abnormal. Not noting anything out of the ordinary. I'm going to check for the size of your liver. Which is normal, not enlarged. I'm going to press down on your kidneys. Just a slight pressure and release. Excellent. So, not noting anything abnormal whatsoever, I'm going to use my stethoscope to listen to the sounds coming from your internal organs. Maybe a little bit cold, I apologize. Just breathe normally for me. So I'm able to hear activity that is normal in all 4 quadrants. No gurgling, no swooshing. I'm hearing normal bowel sounds. Your tummy has just a normal amount of internal acoustic activity. normal sounds. Okay, I'm going to percuss next and check for the resonance coming from your internal body, from your tummy all the way up to your chest. Let me know if you feel any discomfort. Excellent resonance sounds in your tummy. I'm going to move up to your chest. Checking for a retrosternal thyroid over here. No such indication. So I'm getting excellent resonance sounds. Do you feel any pain when I press down on your shoulders here?
No.
Excellent. Okay, I'm going to progress down over towards your legs and your feet. So just doing a light palpation. Any pain here? Any pain on your knee? Not noting any tenderness, nothing is swollen. No indication of any edema. I'm going to check the sensations in your legs as well. Can you please tell me if this is comfortable? Oh, comfortable feeling?
Yes, thank you.
No sharp shooting pain?
No.
Any loss of sensitivity or sensations?
No.
Okay, most excellent. Going to do the same on this leg. Just a light palpation. Any pain here?
No.
No pain. Any pain over your knee?
No.
And how about here in your calf muscle? So no signs of any edema. Skin is very clear, no redness, no signs of psoriasis, no abnormal moles, normal temperature. Not able to see anything out of the ordinary. I'm going to focus on your feet next. Alright, cat, so your legs look perfectly healthy. I'm going to focus on your feet next. I'm going to begin by doing a light palpation. Pressing down on your plantar region. Do you feel any pain here?
No, just a little bit of tingliness.
Just tingliness. I'm going to attempt to bring your toes towards your head. Resist that motion. And I'm going to try to bring them towards me. Resist that motion. Does this hurt?
No.
How about this?
No.
And can you push into my palm with your heel? Very good. I'm going to try to bring your leg up. Resist that. Very good. And can you please hover your leg a little bit up? I'm going to attempt to press it down and bring it towards the table. Resist that. Very good. Okay. I'm going to check the sensitivity in your skin next. Can you please tell me where you feel this?
My toes.
Your toes, very good. And do you feel this?
Like.
How about this?
My ankle.
And how about this? Okay, I'm going to touch you with two different textures, dull and sharp. Which one is this?
Sharp.
How about this?
Dull.
And this?
Dull.
And this one. Excellent. Alright, I'm going to perform the Babinski test next and swipe my hammer over your sole. Excellent, negative Babinski, that is a normal response. Okay, capillary refills within 3 seconds, normal temperature on your foot here, the same as on this one. Going to check for your pedal pulse, 2+, very good. The pulses are synchronized in both of your feet, which is excellent. Not noting any lesions, redness, no signs of psoriasis, no clubbing of the nail or nail splitting, which is a very good sign. This foot is very healthy. I'm going to focus on this one next. Going to just palpate it first. Palpating your plantar region. Any pain there?
No.
Okay, most excellent. Skin sensitivity test to check for your nerves. Can you please tell me if you feel this?
Yes.
And where do you feel this? Where do you feel this?
My toes.
Do you feel this?
Yes.
And this?
Yes.
Excellent. I'm going to touch you with two textures, dull and sharp. Can you please tell me which one this is?
Sharp.
How about this one?
Dull.
Very good. And this one?
Sharp. Dull. Dull.
How about this?
Dull.
And this?
Sharp.
And this. Excellent. Okay, can you please let me know if you feel any tingling or any uncomfortable sensation?
It's comfortable.
Comfortable. Okay, very good. How about over here?
Comfortable.
And over here.
Comfortable.
And here.
Comfortable.
Excellent. Finally, I'm going to do a Babinski test on this foot. Excellent, negative Babinski as well. Taking the pulse, pedal pulse 2+, capillary refills within 3 seconds, normal as well, normal temperature. Okay, both of your legs and your feet check out and they look perfectly healthy to me. You can come back up. All right, Katharina. So I'm just going to take a couple of quick notes of all the assessment that we did. Normal arms, abdominal region was perfectly healthy, same as your legs and your feet. So everything checks out just fine. There are no red flags, no sign of any concern. I do recommend that you come back and see me within 5 to 6 months for another medical examination just to stay on top of your health. But other than that, I find you very healthy and it was a pleasure seeing you today.
Well, thank you so much for that medical assessment. I really appreciate it, and I hope you have a really good rest of your day too.
Thank you as well, my pleasure.